Getting enough sleep every night is very important, but do you know the facts and myths about sleep? We spoke to Dr. Dennis Nicholson at Pomona Valley Hospital Medical Center, who has the answers to many questions about our sleep.
You can make up sleep deprivation by increasing the sleep the following day. A lot of people do that on weekends. There is a range of need for sleep from 4 to 10 hours. And if one looks at a normal population, there are some people who function quite well on 4 hours. They're very unusual. The 24-hour society demands that, and most people don't do well on a lack of sleep. Power naps or a nap that occurs can really make a difference in how one functions. For example, if you're extremely tired, I prefer that you pull over in your car and take a power nap than continue driving because you're putting yourself at risk. If one drinks alcohol before going to bed, you will increase the problem with breathing during sleep, mainly sleep apnea. And alcohol causes rebound after about 4 hours. It wears off and you're more awake than you would have been without it. Milk, on the other hand, has some, we might use the term soporific quality, makes people a little sleepier. And the mattress is, in a sense, important in that comfort is important during your sleep. On the other hand, that doesn't obviate the problems or take care of the problems with things like sleep apnea or other things such as insomnia for a different reason. As far as the quality of sleep as we get older, it tends to be less efficient. We still need the same amount. There is somewhat of a myth that you need less sleep as you get older, but the efficiency of sleep worsens. So older people tend to stay in bed longer but get the same amount of sleep, so their sleep efficiency is worse. Some worry about it, and some older folks start to go to bed earlier because of the variety of factors. And then they wake up at 2 or 3 in the morning and they're wide awake, but they've still had the same component of sleep. One of the gravest dangers that older people especially face is starting to take a sleeping pill on a regular basis. Here's the problem. Most all of the sleeping pills, in fact, every one I know of, have addictive qualities and cause rebound insomnia. So if you stop taking it, it makes the insomnia worse. Or it can actually cause tolerance, so you need more and more of it. No study has shown that sleeping pills work beyond a couple of weeks. One study showed up to 6 months, but they have major dangers if taken for a long period. I strongly recommend that if you're unable to sleep, you get out of your bed and go in another room. You may watch television, you may read, but the problem with lying in bed trying to sleep is that just the word trying. As you try, it makes you more anxious and actually fights sleep. So there are a lot of, at least 11 good controlled studies that have shown that's a bad idea. Nightmares are usually a manifestation of a trauma of some kind, either depression or commonly we see it with post-traumatic stress disorder. Awakening from a nightmare is how you remember the nightmare. So sometimes conditions like sleep apnea can make you think you're waking up with nightmares. But if the quality of the dream is such that it's frightening, I think psychological help is important.